Good evening, everyone, and good evening, world. In line with International AIDS Candlelight Memorial 2021, Adventist Medical Center Iligan, Haven, currently organizing the activity HIV Social Awareness Campaign through digital concert. And last week, you have heard Dr. Mary Jane V. Concepcion, our hack physician, who have shared about HIV 101, what is HIV, and prevention. And for this week, I'll be sharing to you one of the topic, Republic Act 11166. This features which was approved year 2019 by our President Rodrigo Roa Duterte, which talk about an act strengthening the Philippine Comprehensive Policy on Human Immunodeficiency Virus or HIV and Acquired Immune Deficiency Syndrome or AIDS, prevention, treatment, and support. And reconstituting the Philippine National AIDS Council or PNAC, and repealing of the Purpose Republic Act Number 8504, otherwise known as Philippine AIDS Prevention and Control Act of 1998 and appropriating funds thereof. So among the key features of this law, 1. HIV and AIDS education and information in health, facilities, schools, workplaces, and communities for Filipinos going abroad, tourists, and transient. So schools are priority areas for education to our young people for basic information about HIV and prevention. And appropriate information about prophylactics. Example, condom and lubricants. And HIV testing for all donated organs, tissue, or blood. A second testing may be demanded as a matter of right except during emergencies. And this is one of the services of AMCI for the screening. Next, we have Department of Health to issue guidelines on precautions during surgical, dental, embalming, and tattooing procedures during handling of disposition of cadavers and body fluids. So in Article 4, screening, testing, and counseling, so there must be written consent for HIV testing and disclosure. According to Section 29, as a policy, the state shall encourage voluntary testing. Written consent from the person taking test must be obtained before testing. So AMCI, highly implementing voluntary testing among our patients, clients who wants to be tested, and even to the community-based screening conducted by our City Health Office in Iligan. They have also highly implementing VCT together with the written consent. And HIV testing shall be made available under the following circumstance. In Section 29, if the person is 15 to below 18 years of age, consent to voluntary HIV testing shall be obtained from the child without the need of consent from a parent or guardian. So in order to meet the increasing HIV cases, the new law provides for the lowering of age of consent from 18 to 15 years old. But this will be assisted with the psychosocial intervention from the social workers or healthcare workers to enable them to get tested and to be diagnosed. And if diagnosed, they will be guided to access early ERT as stipulated in the law. In Section 29, in keeping with the mature minor, any young person aged below 15 who is pregnant or engaged in high risk shall be eligible for HIV testing and counseling with the assistance of a licensed social worker or a healthcare worker. So year 2019, the DOH-10 and AMCI has a strong collaboration of HIV treatment, care, and support. Thus, AMCI Haven was accredited treatment hub in Iligan City for easy access, especially to the people who are most at risk in the population and to lower mortality of HIV and AIDS cases in the city, and immediate medical treatment, especially to those with opportunistic infections such as STI or sexually transmitted infection, pulmonary tuberculosis or PTB, and oral thrush, and others. Article 5, Health and Support Services. In Section 23, Treatment of Persons Living with HIV and AIDS, the DOH shall establish a program that will provide free and accessible antiretroviral treatment and medication for opportunistic infection to all people living with HIVs who are enrolled in the program. In year 2019, the DOH-10 and AMCI has a strong collaboration of HIV treatment, care, and support. Thus, AMCI Haven was accredited to be one of the HIV treatment hub in Iligan City for easy access, especially to the people who are most at risk in the population and to lower mortality of HIV/AIDS cases in the city, and immediate medical treatment, especially to persons with opportunistic infection such as sexually transmitted infection, pulmonary tuberculosis, and oral thrush. In Section 24, access to medical services by indigents. Indigent persons living with HIV shall not deprive of access to medical services. The Department of Health and Department of Social Welfare and Development Office shall establish a program that will support better access to ERT and medication of opportunistic infection. Another features, no compulsory of testing. So as a precondition for employment, for admission to educational institutions, exercise of freedom of abode, travel, entry of continued stay in the country, provision of medical services, enjoyment of human and civil rights. For medical confidentiality, confidentiality encompasses all forms of communication obtained by health professionals, health workers, co-workers, employers, recruitment agencies, insurance companies, data encoders, and other record custodians. So as hospital facility, we are really strictly implementing the confidentiality of our patients, especially HIV/AIDS related cases for in and out patients. The Adventist Medical Center Iligan had been implementing HIV policy in the workplace as well. So for burial services, no denial of decent burial services to any deceased person known, suspected, or perceived to be HIV positive. Another, bury and unembalm or cremate within 24 hours. No embalming except when requested by the family, done by a trained embalmer, with strict observance of universal precautions. And HIV status not a consideration for issuance of permits to transfer. So in Republic Act 11166, also emphasizes the burial services to the expired PLHIV to ensure decency and non-discriminatory. So in this law also, there will be no discrimination for the following: optimal medical care in hospital, health institutions, and community-based care. So AMCI provides services with no traces of discriminatory issues and are even extending our services to the community. So employment, livelihood, self-help, and cooperative programs, admission to schools, travel and entry, and elective and appointive positions, access to credit, health, accident, life insurance, and burial services. So another features, we will be talking about the penalties for the violations on medical confidentiality. So 6 months to 2 years imprisonment, fines 50,000 to 500,000, and suspension or revocation of license and accreditation. So one of the highlights also of the Republic Act 11166 is the penalties to ensure that the law will be strictly implemented in our facility and in the Philippines. So another, we have the discriminatory acts and policies, 6 months to 5 years imprisonment, and the fines 50,000 to 500,000, and there will be the revocation of license and permits. So for penalties, another, spreading of false information about HIV and AIDS. So there will be 1 to 10 years imprisonment and with fines 50,000 to 500,000, and suspension for or revocation of license and accreditation. And if the offending company party is a health-related company, so there will be 5 to 10 years imprisonment and with fines to 500,000 to 5 million. Knowingly or negligently passing HIV to other people, force HIV testing through unsafe and sanitary practice and procedure. Thus, healthcare facilities are encouraged to practice universal precaution at all times. According to Section 51, in relation to penalties collected, the penalties collected pursuant to this section shall put into a special fund to be administered by PNAC and shall be used for initial interventions required to address gaps in the national response on the part of government agencies and its partners, from civil societies and international organizations. Lastly, both government and non-government agencies are looking forward for full implementation of this law. That made our LGUs or local government units propose to amend every existing ordinance in line with HIV program, treatment, care, and support. And we are hoping that the level of our awareness has been raised, and we invite you to be one in this fight and to achieve zero stigma and discrimination and zero AIDS case, which is one of the global goal of the program. So that's all for Republic Act 11166. I am Rona M, Guillena, HAC social worker and HIV trained counselor, and I am inviting everyone to watch our digital concert with Marian Osabel on May 29, 2021 at 7 p.m. via FB Live and YouTube channel. Thank you so much for watching, and hope that you will continue to watch our program by weekly. Thank you so much and God bless.